Hello, my name is Chanel Durant. I'm a student nurse practitioner at ECPI University. Today I'll be doing a physical head-to-toe assessment exam. I'm just going to wash my hands. As I entered the room, I noticed the patient was well dressed for the weather and he was well groomed. Can you tell me your name and your date of birth?
Yes, my name is Derek Gordon, and my date of birth is February 13th, 1982.
Okay, can you tell me where you are and why you're here?
Yes, at the doctor's office waiting to take a physical examination.
Okay, and can you tell me today's date?
Yes, September the 28th, 2018.
Okay, the patient is alert and oriented times 4. He's alert and oriented to self, place, time, and situation. Can you rate your pain on a scale from 0 to 10, with 10 being the worst?
0 currently.
Okay, the patient denies any pain. Next, I'm going to just assess his head and face. His head appears normal cephalic. It is upright on his neck. Looking at his face, I don't see any lesions or scars to his face. When inspecting his scalp, I don't see any lesions or abnormalities. His scalp is freely movable on his skull. Do you have any tenderness?
No.
Okay. When palpating his scalp, I don't feel any lumps or bumps. His hair is thick and coarse. There's even hair distribution throughout his scalp. Okay, I'm going to have you smile for me. Can you frown? And can you blow out your cheeks? Okay. His cranial nerve 7 is intact. Next, I'm going to be looking at your eyes. Your eyes are symmetrical. Your eyebrows are thick and intact. Your eyelashes extend the length of your eyelid. Your eyelid is freely movable. You're able to blink without difficulties. I don't notice any lesions or open areas to your eyelids. Do you have any tenderness?
No.
No tenderness is noted. Any tenderness here?
No tenderness.
Okay. No tenderness or swelling to the lacrimal apparatus. I'm going to inspect his conjunctiva. His conjunctiva is pink and moist. His sclera, open your eyes. His sclera is white. No redness is noted. His cornea is clear and bright and appears smooth. Next, I'm going to inspect his pupils. So Derek, just continue to look forward for me, okay? I'm going to shine a light in your eye. Okay, both pupils were equal, round, and reactive to light. Next, I'm going to be assessing his sinuses. I'm going to assess the frontal sinus. Does that hurt?
No.
And maxillary? Does that hurt?
No.
Okay. I didn't note any swelling. He doesn't have any tenderness to his frontal or maxillary sinuses. Next, I'm going to be assessing his ears. His ears are symmetrical to his face, to his auricle and pinna. I don't see any lesions or any open areas. I'm just going to be looking inside of your ears, okay?
Okay.
When looking inside of his left ear, the ear canal is clear. I don't see any foreign objects. His tympanic membrane is pearly gray, normal in color. And also he has good cone of light. I'm going to assess the right ear. When assessing the right ear, the ear canal also is free from any foreign objects. I didn't notice any swelling or redness. The tympanic membrane was also pearly gray and normal in appearance, and he also has the conal light to his right ear. Next, I'll be assessing his nose. His nose is midline on his face. His nasal septum is also midline. Do you have any tenderness here?
I don't.
All right. He doesn't have any tenderness. When looking inside of his nose, his nasal mucosa is pink and moist. I don't see any drainage or rhinorrhea. Next, I'm going to be assessing his mouth. His lips are normal color for his ethnicity. I don't see any lesions or ulcerations to his lips. Let me see your teeth. Okay. He appears to have all of his teeth. All of his teeth. I don't see any broken or missed teeth. His gums are pink and moist. I don't see any swelling. His buccal mucosa is also pink and moist. With his tonsils, I don't see any edema, any redness. His soft palate is also pink and moist. And you stick out your tongue and wiggle it from side to side, up and down, and then press against my fingers. Okay. His cranial nerve 12 is intact. So I'm going to have you stick out your tongue and say ah.
Ah.
Say it again.
Ah.
Okay. His uvula rises whenever he says that. So his cranial nerve 9 and 10 is intact. Okay, next I'm going to be assessing his thorax. So his respirations are easy and unlabored. He does have some striae to his chest. His skin is intact. I don't see any open areas. Next, I'll be checking for skin temperature. His skin is warm. He has good skin turgor to his chest. Next, I'll be auscultating for breath sounds. Deeper. Also, I don't see any open areas to the back. I'm going to auscultate deeper. His lungs are clear upon auscultation, and I don't hear any adventitious breath sounds. Next, I'm going to be assessing his heart. I'll palpate the apical pulse. The apical pulse is located at the left fifth intercostal space at the mid-clavicular line. He does have a regular rate on his apical pulse. Next, I'll be auscultating the apical pulse. And I'm going to auscultate for 1 full minute. Okay, his apical pulse has a regular rate at 70 beats per minute. I'm going to be auscultating his heart sounds. Aortic, pulmonic, earth, tricuspid, mitral. I'm going to go back and listen with the bell with the stethoscope. Aorta, pulmonic, earth, tricuspid, mitral. His heart sounds, I heard S1 and S2. His rate and rhythm is regular, and I didn't hear any murmurs upon auscultation. Next, I'm going to be assessing the abdomen. His skin is intact. I don't see any open areas. Inspecting the abdomen, I don't see any masses. His stomach appears non-distended. Next, I'm going to be auscultating for bowel sounds. I'm going to start at the right lower quadrant and work my way around clockwise. Okay, he has active bowel sounds in all 4 quadrants when listening to bowel sounds. Next, Derek, I'm going to do a light palpation on your stomach. Let me know if you have any tenderness, okay?
Okay.
Any tenderness?
No.
Okay, and his abdomen appears is soft with palpation. Now I'm going to do a deep palpation. Any tenderness?
No.
Okay. No masses or abnormalities noted when doing a deep palpation. Next, I'm going to inspect his upper extremities. Okay. No crepitus noted in his upper extremities on his joints. His skin is intact, no open areas, his upper extremities. He does have some striae present on his arms. Next, I'm going to palpate his radial pulses. His radial pulses are +2 bilaterally. I'm going to check his capillary refills in his hands. His capillary refill in his hands is less than 2 bilaterally. Next, I'm going to inspect his lower extremities. His lower extremities, the hair is evenly distributed on his legs, and there is a normal amount of hair growth. It's not excessive. With his pre-tibia, I don't feel any pre-tibia edema. I don't feel any swelling to his ankles or feet. I'm going to check for his post-tibia pulses. And they are +2 bilaterally. I'm going to inspect the bottom of his feet for any open areas. and I do not see any. And then I'm going to check his toenails for capillary refill. And they are less than 2 bilaterally. This concludes my physical head-to-toe assessment. Thank you for watching.